Today we are going to discuss the two mechanisms for excreting concentrated urine. So far we have discussed multiple times that the kidneys have the authority, the power, the ability to excrete dilute and concentrated urine depending upon the circumstances. Now, we have also discussed so many times that it is the release of antidiuretic hormone in large amount which helps the reabsorption of water and ultimately concentrating the urine. So we will initially focus on the two mechanisms that are used by the kidney to concentrate the urine, and in the coming lectures we will discuss them in detail. So first of all, to concentrate the urine there must be secretion of large amount of ADH, the antidiuretic hormone, which acts on the tubule and reabsorb a lot of fluid. It reabsorb a lot of fluid from the collecting tubule, and it leads to concentration of urine, because when water is reabsorbed from the fluid that is going through the renal tubules, the remaining fluid becomes very much concentrated. This is one way of concentrating the urine, but how the how the ADH helps to reabsorb it in some parts of the tubule and not in the other parts, and similarly there is difference in osmolarity in different parts of the kidney, and that is known as hyperosmolarity, high osmolarity of the renal medullary interstitium. Suppose for example this is kidney. Now the outer part is the cortex and the inner one is the medulla. For concentrating the urine or excreting the concentrated urine, there is a mechanism known as countercurrent multiplier, through which the medullary portion, the medullary interstitium of the kidney is high in osmolarity. The osmolarity in the medulla of the kidneys is high. We are not going into detail of the countercurrent multiplier mechanism, but there are a few important things, and one of them is the juxtamedullary nephrons and the vasa recta. There are two types of nephrons in the kidney. The cortical nephrons, they are present here in the cortex, and the juxtamedullary nephrons, their loop of Henle come down into the medulla and then go up. And these types of nephrons are around 25% of all the nephrons. They deep dive into the medulla and then go back. Along with these nephrons, along with the loop of Henle of these nephrons, there are blood vessels coming down known as the vasa recta, and they take the fluid from here and they take it upwards. Now, how exactly the concentration here in the medulla remains high while here in the cortex remains low is the topic which we will discuss in the coming lectures. But here we want to know that the high osmolarity in the medulla of the kidney, high osmolarity of the renal medullary interstitium with the help of juxtamedullary nephrons, vasa recta, and secretion of high amount of antidiuretic hormones are two mechanisms through which the concentrated urine is excreted or urine is concentrated. Now, in the coming lecture, we are going to explain all these things in detail. Thanks a lot for watching the video.